My journey with Catholic Healthcare has been long, it's been interesting, it's been hard work sometimes, and there's been a number of times in my journey, in various roles, that I've honestly stopped and thought, I can't imagine being anywhere else, and this is where I'm meant to be.
So I've been in the not-for-profit sector for a good 20 years, and I've enjoyed making a contribution there where I think maybe we're making the world a little bit better, and that's the objective of what we do, rather than serving other financial gains. Both my mum and dad spent the last years of their life at McEwen Park, which is one of Catholic Healthcare's own facilities. I saw firsthand the care that both of them received at Catholic Healthcare.
Having home care support enabled her to get her home earlier and into a more caring or more sort of cherished environment back home where we could, she felt a lot more comfortable, and I think that speeded up her recovery.
Been a physio for over 20 years and love being a physio. And then a couple of years ago an incident happened in our family that kind of shook us all, where my mum, healthy and fit elderly lady, was down at the dog park and got knocked over by 2 Great Danes. We experienced how vulnerable she became, a hospital admission, ICU admissions. Seeing those changes really made me passionate about wanting to help those that need this help, and to really start my journey off into the aged care sector.
I started off as a botanist, but then I soon realized that this is not for me and moved over to anthropology, and that's where I immediately understood that this is where I belong, and working with people is what I want to be doing all my life. And very soon after finishing my studies and doctorate in anthropology, I wanted to explore the work environment, and I came to community programs, got an opportunity to work with Catholic Healthcare to really be able to bring in my passion to work with communities and elderly people.
In human resources, my role is to really have the right people in the right roles at the right time, and I really get a drive out of going out to our homes and seeing our employees thrive in an environment where they're caring for the elderly as if they were from their own family.
One of the things that I often think of is when my dad had to go and care, and it was a really difficult time for my family. And to think that I belong to an organisation that can respond to the needs of that particular cohort of people, thinking that we can help families to make meaning of what's going on, to give them support and comfort as their loved one is at a very vulnerable time in their life. It's a really wonderful experience to know that I can make a difference in those people's lives.